Hi. Okay, so now we're going to talk about family assessment, family development. So chapters 18 and 19 kind of go over that at the same time. So we'll just cruise through both chapters in this lecture, hopefully. Okay, so the objectives. Explain the importance of family nursing in the community setting. Describe family demographics. Define family, family nursing, family health, and healthy, non-healthy, resilient families. Analyze changes in family function and structure. Compare and contrast the four family social science theoretical framework. Compare and contrast the 4 ways to view family nursing. Explain one assessment model and approach in detail. Describe the various barriers to family nursing. Share the implications for social family policy, and then discuss issues of families in the future. Okay. So the trend to move healthcare to a community setting. Why do we want to do that? Mainly because people do better in the familiar. We are moving out of the whole hospital setting. I mean, hospitals are super important. I was an inpatient nurse. I'm sure some of you worked in inpatient. And then some of you kind of straddle both in where you work. And especially any of you who've worked mother-baby will really understand that, you know, in the hospital setting is just so different from what happens in real life, and people need to kind of start healing in a real life setting. It drives down costs and also prevents nosocomial infections. So we move healthcare to the community setting. Home health nursing, community health nurses, all about home health is just so important. Nurses who, track mother-baby after, nurses who liaison between the inpatient setting and the outpatient setting. Such an important role because you're only in the hospital X amount of time with all those resources, and then you get plopped back into your community. We need to have a strong healthcare support within communities for our patients. So family nursing is a specialty area that has a strong theory base and is more than just common sense, or viewing the family as a context for individual healthcare. Family nursing consists of nurses and families working together to ensure the success of the family and its members in adapting to responses in health illness. So family nursing in the community. Family nursing consists of nurses and families working together to ensure the success of family and its members in adapting to responses to health and illness. So what does that mean? That means, you think about this. Patients who do better have better support, okay, or better health literacy, or resources to get support. So when you have a little old lady who breaks her hip and goes home and is all alone with no support, probably not going to rehab, as well as a little old lady who has 3 daughters and 2 sons and 16 grandchildren, and lives in a community where her neighbors will bring her food, and her cousin will drive her to rehab, versus someone who's isolated, right? Because all of that is part of the healing process. So what are we responsible? Helping families promote their health, meeting families' health needs, coping with health problems within the context of their existing family structure, and collaborating with families to develop useful interventions. So I have a really good example of this. I had a patient who was a very brittle diabetic. She was type 2 diabetic, and as her disease progressed, and she was very non-compliant, and I think there was a lot of, lack of support, health literacy stuff involved. I picked her up. She became my patient when I came to work for the Cincinnati Health Department. By the time she came to me, she wasn't doing great with her disease process. And when I got her, I already was seeing signs of renal failure. So I immediately got a home health nurse involved. She told me, this patient told me she didn't have any family to help her out, and she was clearly not taking her medicines the way she was supposed to. So we got a home health nurse involved. And that was great. Okay, so we got the home health nurse involved, and the home health nurse right away was like, she needs more help, and she needs her family involved. And the patient kept kind of telling me, no, my family's not around, they can't help, they can help. The home health nurse is like, she has her family around, she just doesn't want to help them. And they're, they keep saying that she says she's fine, and so they don't hear you. So it was my job to bring the family, and with permission of the patient, bring the family to come in and talk about these health problems in context of their existing family structure. Now, is that to say that families have to be responsible for their family members' care? No, I'm not saying that. I mean, obviously I would love that, right? I would love to say to everyone, she's your family, you gotta take care of her. However, it's not always possible, right? If you have a daughter with 6 kids or a daughter with 6 grandkids and she's working 2 jobs to keep it together, she's not going to be able to take care of her mom. So it was trying to figure out where can the family fit in coping with their health problems. And then what community resources can we get involved? Counsel for the aging, calling the local church. She goes to a church and they were there to help with her medication. And then collaborating with the family to develop useful interventions. Now, unfortunately, it was just, this all happened too late, and she did end up on dialysis. But I will say that her diabetes is better controlled now, and yes, she's on dialysis, but she's not dead. So that's an example of collaborating with families. Another example I want to share with you is I have a patient who has a lot of health problems, but she really doesn't focus on herself because she has a husband who's very sick with end-stage heart failure. And so what can we do to help her take care of herself? And that's getting her existing family structure. So she has her cousin, her sister, her daughter, having, conversations with them, and then community resources, respite for her to go to her doctor's appointments so her husband can be taken care of. So that's part of family nursing community, which you'll say, okay, Denise, that's case management. Right, but it's in the context of the family as the center. Now, when you're in the hospital, and before, when we just are learning about healthcare, we're never doing it from a family standpoint. Now, in nursing school, we do, because that's the way we were taught. But in general, when healthcare recommendations and guidelines are set, it was never in the consideration of the family. And now we're moving outward from that. So family demographics. So that studies the structure of the family, the household. Are they married? Are they divorced? How many kids are there? Do they have grandkids there? What kind of money is in the house? Where do they live? Because that can forecast stresses and developmental changes, right? If you know they're going through a custody battle with their grandkids, or this woman has her son living with her and he deals heroin out of her home, it's going to affect the way her health problems are addressed. Am I using real life examples? Yes, I am. This happens all the time. And it's your job in healthcare, especially as a nurse practitioner, to find ways and resources to make that work. Now, some things are impossible, right? Someone's too scared to go home and take their medication because their son's stealing drugs out of their house. What's a community resource involved? The police, right? I mean, some environments aren't safe. But this is that idea of the family demographic, family as a patient. So family refers to two or more individuals who depend on one another, emotionally, physically, financially. Members of the family are self-defined. So it's not just like relational. It can be community. It can be, we consider some of our best friends our family. And some people, they bring their best friend to their doctor's appointments. They're a big part of their health care. That happens all the time. And so it's your job to ask what you consider to be your family and include them in health planning, if they want to be included in health planning. So family functions. There's economic function, reproductive function, socialization function, affective function, and healthcare function. Here are the different family structures. I'm not going to go through them with you. Family health, a dynamic, changing relative state of well-being that includes the biological, psychological, sociological, cultural, and spiritual family. I think you can see from this thread what we're talking about is that the family structure is going to affect people's health care, and family health is part of community health. Neither are all good, neither are all bad. They all have their strengths and difficulties and seeds for resilience, and it's our job to find and delineate those things and extrapolate it into how we can provide better health care for them. So here are the approaches to family nursing. Family is the context or structure. Okay, so, this is the structure that they live in. As the client, all right, so you're not just educating the patient, you're educating the family. When you treat mom, you're treating the kids because mom can get better and take care of the kids. Family is a system. They are a resource. They are a group. It is an approachable group. And then components of society, how they interact outside of the healthcare setting. So theoretical frameworks for family nursing. There's family systems theory, family developmental life cycle theory, and bioecological systems theory. And these are really good theories that just talk about how do you approach the family. And I can touch on them really quick. So family systems theory is from Bowen, and he suggests that individuals cannot be understood in isolation from one another, but rather as part of the family, because the family is your emotional center. So that's Bowen systems theory. And it's kind of that idea that, you know, how when, I'm sure even for you guys, when you're in school and they're like, well, I don't know. When I was in undergrad, it was like, I don't care about what's going on in your family life. You're a student of nursing, and that's all you are to me while you're here. Which is nice when you're in, you know, like right now in this program. Like I've said, you know, if you have issues, I will work with you to make you get your assignment in. We'll give you extensions, whatever you need. It's that idea. You can't separate the person from their family system. And again, this doesn't mean just like mom and dad. It's what, not just a nuclear family, it's what a person considers their family. The family life cycle development theory definition. So it's the approach to studying families. So it's useful in explaining pattern changes of and the dynamic nature of family and how change occurs in the family life cycle. So as you move over time, you change through these successive stages, right? So when you're creating your family, the stressors and priorities are different. And then the bioecological systems theory. So that's the theoretical model of gene-environment interaction in human development. And that's that idea that, you know, we have, some people are saying, okay, I'm sure you've seen those memes on Facebook. I have diabetes runs in my family. And you're like, no, nothing runs in your family. That's why you have diabetes in your family. You know, we are all genetically predisposed to things, and how our environment is will tell us what our genetic outcome will be. So those are those three theories, and you can get into them more in your book, and I will try and find some cool articles that kind of go into it a little more. So when we work with families for healthy outcomes, there's the pre-encounter data collection. So finding out stuff before someone comes in. And a really great example of this, and it's hard to do it, right, because we only have so much data, but, you know, you're going to go take care of a lady who just broke her hip, and you're there to kind of help manage her chronic care issues. What data can be collected before you go and work with this patient and their family? Well, is their daughter in the middle of, or son in the middle of a divorce and handling two jobs? Because if so, that's going to change your approach to how you involve the family. Determine where to meet the family. Maybe people don't want you to come into their home because they're ashamed. I know that, like, for example, my lady who has heroin being dumped out of her house, she doesn't let the home health nurses come to her house. And we don't want them there either, right? We don't want our home health nurses risking their lives. So they meet somewhere else. They meet where she can bring her medicine and they can be taken care of. So they meet at the local community center. Make an appointment with the family. So I do this. I bring the family in to see me. We send the home health nurses out to see the whole family. Plan for your own safety, obviously. Interviewing the family, defining the problem. So what is it? Okay, mom isn't getting her rehab. What is the problem? Mom doesn't take her medicine, and no one comes to their appointments. Why is that? Well, all her appointments are scheduled on Mondays, and I work Mondays. Okay. Designing family interventions, so we use our family nursing diagnoses in evaluation of our plan, and involving the family with that. So the family nursing assessment. Family nursing assessment. So we look at family problem areas, they're identified, and family strengths are emphasized as the building blocks for interventions. And then we look at family assessment intervention model. So, sorry, I'm trying to find it. All right, so it's a collaborative approach to support multi-challenged families. It's a, you look at families focused in-home approach, and you develop based on their challenges. So if you have a poor family or a multi-problem family, that's what they like to be called. There's psychosocial risk, maltreated, neglected children. You integrate clinical and educational social resources to help approach the family. Sometimes treating the patient means treating the family. So these are the different policies that we use to address social and family problems. Healthy People 2020 emphasize on individual and community issues and includes the families. So hold on 1 second, I'm going to pull up the next PowerPoint. So now we talk about family health risks. All right. So we're going to focus on family because it's vital in promoting the health of the individual. We just talked about that. Knowledge of family structure and functioning is fundamental to implementing nursing process. We just talked about that. And we need to go beyond the individual and family to understand the complex environment. So you have someone who comes in and they have hypertension. You recover someone after a heart attack and you're teaching them about diet education. You need to understand their family function. And if everybody in that house is just eating ramen noodle, well, then you need to educate the whole family on their risk of sodium. So there's genetics, age, biological characteristics, personal health habits, lifestyle, and environment. All right, so historically we focus on the effect of illness on families, the role of family in the cause, and the family in the use of services. There's increased attention to improving the health of everyone in the U.S., and limited attention has been given to the family health risk and the role of society in promoting healthy families. So our concepts of family health risk, we talk about family health risk appraisal. How do we reduce this risk? What do we do for the family in crisis? What life events are going to put a family's health in jeopardy? And how does lifestyle play into this? So there's biological and age-related risks, right, are genetic. So if you have familial hyperlipidemia, you're at risk for heart attack and stroke right off the bat. Even if you run marathons, even if you're vegan, you're still at very high risk of having heart attack and stroke. Because these are people who are genetically inclined to having high LDL. And studies show that people with hyperlipidemia, even at birth, these kids come out with, plaque already in their heart. So, okay, they have this genetic risk factor. What are their environmental risks? Are they poor socioeconomically? Do they not have a grocery nearby where they can buy healthy food? Can they not afford medicine to help control their LDL? Do they go to the doctor enough and get their cholesterol checked? And then behavioral risks. Do they exercise? Do they sit in front of the TV all day and eat? Do they drink a lot? And then the family health risk appraisal. As a family, is this a sedentary family? Is this a family that eats out a lot? All of that will go into looking at someone's health risk for CAD and heart attack and stroke. Community-oriented nursing approaches to families. So home visits, what are the purpose of that? Okay, so the purpose of that is to meet the family, meet the environment that a patient is in, and the individual and family works together. And you look at their advantages and disadvantages, and then you make a plan, right? So you go and initiate, and you're just going to look at stuff. See what's going, or initiation, you get the order. Pre-visit, you kind of plan, figure out what's going on with the family. Then you go in home and you assess everything. And then you will hopefully implement, leave, and then post-visit phase to follow up with the family. So contracting with families. So you begin, which is the pre-planning. The working is when you're there, and termination is when you leave. So empowering families is directed toward building the nurse-family partnership, and you emphasize health risk reduction and health promotion. So, you have a family taking care of children who are failure to thrive. How can you empower this family to prevent, malnutrition? So what is the nurse-family partnership going to be? And then emphasizing health risk reduction. Okay, everyone here needs to get their whooping cough vaccine updated because you have small babies in the house. Stop smoking in the house when you're taking care of a baby who is in the NICU. Those are health promotion of the family. So you look at vulnerable populations when it comes to families. You look at LGBT. And then specific resources vary from community to community. And here are all the different options. So nursing skills that we do. So sharing information with family. As long as you have the permission from your patient, you can share information with the family. So I have lots of patients who I see, and then I call their daughter right after and say, this was my plan to make sure it happens. Rehearsing with families what questions to ask. When they go see the doctor, here's a list of questions you need to ask. Here's some material. This is the paperwork that you need to have filled out for his colonoscopy. Let me help you fill it out. Here is the phone number to get in contact with WIC. I can help you make that appointment. And here's transportation that I can arrange for you. So here's, FMLA helps with those policies. Okay, and that's it.